Hello everyone, thanks for joining me today for this discussion on miscarriage and traditional Chinese medicine. My name is Gina Reno and I practice fertility and pregnancy acupuncture at the Holistic Institute of Health and Fertility here in Calgary, Alberta. So fertility and pregnancy acupuncture. You may have heard a lot lately in the news about how acupuncture can really help with fertility, especially with IVF and IUI. Now, out of the last 30 years of all this research on fertility, a new frontier has been born, and that's the research on miscarriage. Now, Western medicine has done many studies on miscarriage and how it can help, but really we found that Chinese medicine, acupuncture, can really help prevent and treat miscarriage. Now, throughout this discussion, I'm going to use acupuncture, Chinese medicine, and herbs interchangeably to mean the different therapies that are open to people for treatment. So what are the causes of miscarriage? Basically, research results really keep changing. Currently, though, causes include genetic and chromosomal abnormalities in the egg, sperm, and developing embryo, immune mechanisms, low progesterone, uterine abnormalities, infections, and sometimes the cause is just not known. We also know that with no previous baby, miscarriage increases with each following miscarriage. What this means is that if a woman has not had a previous baby and then miscarries, the likelihood of miscarrying again increases with each following miscarriage. We also know that after 40, miscarriage rates increase rapidly, mostly due to genetic abnormalities. There's much evidence to show that miscarriage is not caused by exercising, traveling, having sex, eating the incorrect foods, drinking alcohol, morning sickness, previous terminations of pregnancy, stress, worry, or being unsure of wanting a baby. All these do not affect miscarriage rates. Although some research shows that a severe negative life event 3 to 6 months prior to a pregnancy or conception may increase the chances of miscarriage. But the good thing is seeking out help and support and regular acupuncture or other wellness treatments have a positive effect to decrease the stress of the event, thus increasing the chance of carrying a baby to term. So even in the case of a severe life event, seeking out regular acupuncture treatments can help lower the stress of that event and in turn help bring a baby to term and help a mommy stay happy and healthy throughout her pregnancy. So when it comes to Western therapies, many have been investigated for recurrent miscarriage. Unfortunately, time and time again, these studies have proven to have little or no impact on preventing miscarriage. Now, this is where acupuncture, herbs, and Chinese medicine offers hope with the effective treatment for both threatened and recurrent miscarriage. Chinese medicine has a lot to offer in the field of miscarriage and to help carry a baby to term. There's also a lot of talk on progesterone and how that can help in retaining pregnancies. We know that it's very important to help retain a pregnancy, but research shows that direct supplementation of progesterone to the mother, again, has little to no effect on carrying a baby to term, and unfortunately has many side effects. But what about increasing the mother's own levels of progesterone? What about helping the mom create her own levels? Again, this is where acupuncture can help, because acupuncture has a homeostatic balancing effect on the body. What this means, it helps the body do what it needs to do. So in this case, after conception, it can help the mother's body balance so it can increase its own progesterone naturally and thus helping carry a baby to term. Acupuncture also regulates the body in many ways, regulating the immune response, and it facilitates the mom's own body in producing hormones like relaxin and, as we mentioned, progesterone. Acupuncture and Chinese medicine treats all types of miscarriage. When I say that, I mean because miscarriage is divided into 3 categories. It can help in the beginning of conception with encouraging adhesion at days 6 and 7. Acupuncture also helps with implantation of the blastocyst. Blastocyst is just the cluster of cells or the early embryo at days around 9 or 10 after conception. But most importantly, I want to stress that there are options. Women have options when they're at risk or higher risk of miscarriage. There's more than they can do than just sit at home and put their feet up. They can come in, actively seek treatment, and we can help them carry their pregnancy to term. So this is a very interesting diagram. You can see the development of the embryo at weeks 4, 5, 6, and 7. And during implantation, cells are fiercely dividing and lots of blood cells are building. Encouraging microcirculation in the uterus via acupuncture is key during this time. Now, this encourages implantation of the early embryo so that a positive pregnancy test can be reached at around day 14 after conception. If a woman experiences recurrent miscarriage at the 4 to 6 week mark, this can indicate an imbalance at the initial stage of development, and acupuncture can help. Acupuncture treats the root cause of miscarriage. Now, it's important to understand that acupuncture in Chinese medicine treats the person. So not every woman that comes in for treatment of recurrent miscarriage will receive the exact same treatment. We are all different with our unique health histories. Each individual is treated uniquely, and treatments of acupuncture and herbs are tailored to your needs at that time. During a treatment, a mother can expect to be asked a lot of questions. Questions that will be asked are things like, is there spotting? How much? Is there any pain? Where is it located? Is there bloating, fatigue, irritability, palpitations? If you've ever had an acupuncture treatment, you'll know that I would also ask to look at your tongue, and I would carefully take your pulse. All these give me clues on how to treat you, what herbs to use, and what acupuncture points that you need at that very moment. Some of the acupuncture points that I may use are found at the top of the head or the inner leg, for example. So I talked a bit about microcirculation. Chinese medicine and herbs increase microcirculation, which has a huge impact on complex disorders, including the initial implantation of the fertilized egg and preventing miscarriage. Herbs and acupuncture can also help with the healthy characteristics of blood serum and its cellular components and coagulation or clotting ability. In China and Japan, there's been many studies, and they show how acupuncture and herbs specifically help with preventing miscarriage. They do this by helping the quality and health of the blood in the mother, both before and after conception. Some of the more common herbs we use are pictured here. You can see astragalus, dodder seeds, and angelica. Some herbal formulas or combination of herbs we use have very interesting names. For example, fetus longevity pill or rectify the center. In Chinese medicine, herbal formulas are widely used again and again, and they are designed and tailored carefully to what your need is at the time. Now, in the case of inevitable miscarriage, acupuncture and herbs can offer comfort to both the mother and a natural alternative to surgical D&C. Or both the D&C can be performed, and acupuncture and herbs can help with that healing. That healing is both physical and emotional. This can be a very difficult time for a woman, and support can be offered to help heal the mind, body, and spirit in preparation when she tries to conceive again or decide what her next move may be. Miscarriage can be extremely painful and something experienced in silence, and it does not need to be. We offer a lot of support, and there are a lot of options for healing. Grieving is normal, it's a process, and it takes time, and it's different for everyone. There's no right recipe or right amount of time. Acupuncture again helps women through the process by helping the body heal, rebuild, and process all of the emotions so they're ready again. Acupuncture treats all miscarriages uniquely, as each individual is unique. In fact, no one person will receive the same treatment when they come in. I look at every miscarriage uniquely and tailor the treatment for that person's unique needs. Also, the timing of the treatment is different. It depends when the mother comes in. Of course, they can take a preventative approach and come in before conception, or they can come in while they know they're pregnant, or they can come in while they're having symptoms right at that moment. Acupuncture can offer hope and alternative treatments. Keep in mind the best ways to prevent miscarriage is to prepare your body for pregnancy through health and wellness programs. Usually this can include weekly acupuncture, herbs, nutritious food, and regular, mild exercise. A daily herbal formula designed for you with weekly acupuncture leading up to conception, throughout implantation, and the first trimester is a must in order to best prevent miscarriage, especially in cases of recurrent miscarriage. There are always options. Yes, rest is important, and you can be proactive in preventing miscarriage. If you have experienced them in the past, please call the clinic with your questions. My name is Gina Reno, and I practice fertility and pregnancy acupuncture and women's health at the Holistic Institute of Health and Fertility here in Calgary, Alberta. Please find me on Facebook. I'm also on Twitter, and if you have any questions, you can private message me and I'll be happy to help. I love what I do, and you can ask me any and all your questions. Also, our website is fertilecalgary.com, and there's lots of information on there.